Welcome to today's lecture on biologics in the treatment of asthma and nasal polyps. Let's dive into how these advanced therapies work, why they're so effective, and who they're designed for. Biologics are a class of targeted medications derived from living cells. They're designed to interrupt specific pathways in the immune system. Unlike standard medications, which may broadly suppress the immune system, biologics are precise, focusing on key molecules responsible for inflammation. This targeted approach can lead to fewer side effects and more effective symptom control. In ENT practice, we often see patients with severe, uncontrolled asthma and chronic rhinosinusitis with nasal polyps. For some patients, standard treatments like inhalers, nasal sprays, and corticosteroids aren't enough. This is where biologics can be transformative, especially for those with a strong inflammatory component driven by allergens or immune dysregulation. Let's look at some of the key biologics used for asthma and nasal polyps. Omalizumab. This biologic targets IgA antibodies, which are heavily involved in allergic reactions. By reducing IgA levels, omalizumab helps decrease inflammation in patients with allergic asthma and may even reduce polyp size in some cases. Dupilumab. Dupilumab is a popular choice for both asthma and nasal polyps. It works by blocking two important proteins, IL-4 and IL-13, which play a major role in driving inflammation in both asthma and nasal polyps. For patients with type 2 inflammation, dupilumab can significantly reduce nasal congestion and improve breathing. Mepolizumab, rislizumab, and benralizumab, these biologics specifically target eosinophils, a type of white blood cell that can be elevated in severe asthma and chronic sinusitis. By reducing eosinophil levels, these biologics help lower inflammation and prevent asthma exacerbations. Most biologics are administered via injections, either by a healthcare professional or at home with a pre-filled syringe. The frequency of administration varies depending on the drug. Some are given once every 2 weeks, while others may be monthly. Patients usually start seeing results within a few weeks to a few months of starting treatment. Biologics aren't for everyone. They're typically reserved for patients who have tried and not responded to conventional treatments. Ideal candidates include patients with severe, uncontrolled asthma, especially those with a high level of eosinophils. Individuals with chronic rhinosinusitis and nasal polyps who have not responded to surgery or corticosteroids. Patients with recurrent exacerbations, frequent oral steroid use, or persistent symptoms despite treatment. One of the major benefits of biologics is their ability to reduce reliance on corticosteroids, which can have serious long-term side effects. Many patients on biologics report fewer asthma attacks, improved breathing, and reduced need for surgeries for nasal polyps. As with any medication, biologics do carry some potential side effects, although they are generally well tolerated. Common side effects can include injection site reactions, mild respiratory symptoms, and, rarely, allergic reactions. It's important for patients to be closely monitored by their healthcare team, especially when starting a biologic. To wrap up, biologics represent a major advancement in the treatment of severe asthma and nasal polyps. Their targeted approach allows us to address the underlying causes of inflammation, providing relief for patients who might otherwise struggle with chronic symptoms. If you're considering biologic therapy, or if you have patients who may benefit, it's essential to work closely with an ENT or respiratory specialist to determine the best approach and to monitor progress closely. Thank you for watching. For more detailed lectures on ENT treatments, including the latest advances in biologic therapies, scan the QR code to subscribe to my channel. Stay tuned for more updates.